Newark Airport, CDC quarantine officers surround a sick passenger on United Flight 998 from Brussels. It was determined the passenger did not have Ebola. The scare coming as the calls get louder for more aggressive screening for the deadly disease at U.S. airports.
The first person to die from the Ebola virus here in America is now part of a dark medical history. And a majority of Americans have made the call. They want all flights from Ebola-infected countries banned from coming to the United States. This as 3 more people are suspected of contracting the virus in Spain. The CDC claims they're doing everything possible, and the World Health Organization is warning an Ebola spread to Europe is unavoidable. Welcome to MidPoint. Lawrence Gostin is a global health law professor at Georgetown University and director at the World Health Organization Collaborating Center on Public Health Law and Human Rights. Mr. Gostin, thanks so much for joining us today.
My pleasure.
Would you please expand a little bit then on the World Health Organization saying that an Ebola rush, if you will, or an infestation is unavoidable in Europe at this time? What does that then tell us about Europe's preparedness and what they are able to do without any help?
Well, I don't think there will be an influx or a large outbreak or epidemic in Europe. I think that's extremely unlikely. But I think Europe is at greater risk than the United States because they share a border with Africa, and most international flights from the 3 affected countries come into European cities, which is much different from the United States. That being the case, I think it is inevitable that there will be more cases in Europe. There'll probably be more in the United States as well. But I do think that there is the capacity so that it won't spin out of control the way it did in these 3 countries. The big nightmare scenario, of course, is the fact that it could end up in a major African city, Lagos, in a way that takes hold, Johannesburg, or it might go to Delhi in India, or Beijing in China. And there you would have not particularly strong health systems that would have to cope, and that would be our nightmare scenario.
I want to get back to what you said. You said more in the U.S. as well. I'll get back to that in a moment. But here's from the World Health Organization saying that the western part of the European region particularly is the best prepared in the world to respond to viral hemorrhagic fevers, including Ebola. Western part of Europe. Yet you just indicated something that we don't talk about much, and that is simply that is it not still out of control in many countries in Africa? And simply stated, the possibility of spread at this point because of their medical systems is very likely. There's really no way to clamp that down. We haven't figured out how to stop it in Africa yet.
Well, we haven't figured out how to stop it in Sierra Leone, Guinea, and Liberia, where it is spinning out of control. And the neglect, the delay has been totally unconscionable. We may just be facing an AIDS type of scenario where you have more and more cases. As I say,
well, but let me interrupt you for a moment here. You said an AIDS type of scenario. So we are looking then at this being global, sooner or later, no matter what we do.
Well, no, not necessarily. I think if we let it continue to spin out of control in those 3 countries, and if we are very lucky that it doesn't take a foothold in a low or middle income country, it's possible that we could prevent a cataclysmic spread. But we will see it in Europe, we will see it in the United States, and we'll see isolated cases elsewhere. This is very worrying, right? You know, we thought since 1976, there have been 26 outbreaks of Ebola. None have gone anywhere. And now we have devastation in the region. And the last thing in the world we want is another global outbreak. We've got to do everything to stop this.
I have about 30 seconds left, then we're going to take a break and come back. But in your opinion, does the World Health Organization have everything it needs right now to stop this from getting out of Africa and becoming that global incident?
No, nothing could be further from the truth. The WHO is weakened. It has a budget that's about 1/4 of the CDC's budget. for its global responsibilities, and it's lost all of its response staff. So no, the WHO is not going to be the one to do it, but U.S. military, CDC, UN Security Council, the World Bank, MSF, they might do it.
Okay, hold tight. We're going to take a break and come back next. The American reaction, and if we are indeed the only ones who can help get Ebola under control. It's next on MidPoint.